Student loans are a big problem for pharmacists. With graduates facing interest rates above 6%, it can be hard to get traction and make progress. If you're not pursuing the Public Service Loan Forgiveness Program and you don't need income-based repayments, refinancing can be a great move and can help save you big. Check out our refinance page at yourfinancialpharmacist.com/refinance, where you can calculate your savings and check your rate with one of our partner companies that are offering exclusive cash bonuses of up to $500 to the YFP community.
You just have to stick with it. And the first episode that you do, or the first thing that you do, and maybe you're going to do video, maybe you're going to, whatever you do, it's not going to be perfect. You just have to get version 1 out there.
You're listening to the Your Financial Pharmacist podcast, a show all about inspiring you, the pharmacy professional, on your path toward financial freedom. Hi, I'm Tim Church, and welcome to another edition of the Side Hustle series, where we talk about ways you can create additional streams of income to reach your financial goals faster and highlight pharmacists who are doing this to help you get inspired. On today's episode, I interview Dr. Hillary Blackburn, who is a clinical pharmacist and the Director of Pharmaceutical Services at Dispensary of Hope. She's also the creator and host of the Talk to Your Pharmacist podcast and the founder and CEO of the Natural Products Resource Center. Hillary, thank you so much for taking the time to come on the show and for being part of this Side Hustle edition.
Awesome. Thanks, Tim. It's an honor to be a guest.
Yeah, we're reciprocating, right? Since you gave me the opportunity last year, that was really cool to be a part of your show.
Absolutely. Yeah. I love getting to share with other pharmacy leaders and even getting to meet them in person. Tim Ulbrich was just down in Nashville a few weeks ago and had the pleasure of getting to connect with him as well. So always fun to do some collaborations.
Yeah, when we met last year in Nashville at the APHA annual meeting, it was pretty easy to tell that you're somebody who's not only passionate about our profession, but also entrepreneurship. So it's always fun to get a chance to talk with you.
Yeah, yes. It's fun to be with other like-minded pharmacists, for sure.
So can you talk a little bit about your career path as a pharmacist?
Sure. So I'm Hillary Blackburn, currently Director of Pharmaceutical Services at Dispensary of Hope, the creator and host of the Talk to Your Pharmacist podcast, and the founder and CEO of the Natural Products Resource Center. So clinically trained and have been practicing for the past 8 years in a variety of settings. So my career has taken a few unexpected paths, but ultimately have, led me to where I am today. So, after attending pharmacy school at the University of Mississippi, I definitely selected rotations to get a very broad experience in clinical rotations, but even served as an intern during 2 summers with the Health Resources and Services Administration's Office of Pharmacy Affairs in Washington, D.C. Even attended APHA's Summer Leadership Institute during one of those summers, which was an excellent experience if any students get the chance to go. And some of you may know that HRSA, the Office of Pharmacy Affairs, oversees the 340B program, which is a program to support the hospitals and clinics across the country who are serving the safety net population. And this was a really unique opportunity because I was able to explore more of that public health standpoint and how to operationalize a national program. And growing up in the Mississippi Delta, I was very familiar with some of the lower income population and just had a passion to give back and serve in that way. So after graduating from pharmacy school, I completed my PGY1 residency at the University of Mississippi Medical Center and continued on with that clinical care of being in the ER and ICU, rounding with the internal medicine teams, even having, experiences in the ambulatory setting. And, after residency, I moved to Nashville and thought I was going to continue on in that path with hospital and really clinical pharmacy. But realized that I wanted to change that a little bit, and actually worked in the independent pharmacy setting for a family friend. And then spent some time working for a health plan, learned all about the prior authorization process, refined my formulary management and development skills, and then worked at a specialty mail order pharmacy. So all of those different experiences really have kind of culminated into where I am now, which is full-time at the Dispensary of Hope, which is a charitable medication distributor, for those of you who aren't familiar. So since 2012, Dispensary of Hope, which is based in Nashville, has assembled a collaborative of most of the largest drug manufacturers in the pharmaceutical space and most of the largest health systems that are serving the uninsured. And so what we do is we partner with these pharmaceutical companies who donate medicine to us as a wholesale distributor, and then we distribute it to clinics, FQHCs, charitable pharmacies, and hospital outpatient pharmacies across the country, serving over 160 pharmacies and clinics in about 31 states now.
Wow.
So it's really grown a lot. And, this was a role that didn't exist before I started in this position. And so I've been able to really create this as my own, unique role, and have really expanded those responsibilities. So, not only am I still maintaining our formulary, which I started doing as a volunteer when I had some of my other roles, but now I'm consulting with pharmacy leaders across the country, sharing expertise on affordable medication access, helping with any strategy development for implementing programs to address gaps in pharmaceutical care, lead our research, and create tools for successful program implementation, and help maintain partnerships with some of our external partners, such as colleges of pharmacy. So it definitely keeps me busy, but I still have some time and some passions for some other projects.
So what's your day-to-day look like at the Dispensary of Hope?
Yeah, well, it varies, which I thoroughly enjoy. So because we're a wholesale distributor, we do not see patients, which I do miss that aspect of pharmacy practice. That there's definitely a value of being able to see that direct impact on a patient's life that you're helping and improving. But day to day, it varies anywhere from, attending meetings with the rest of our team. We do not have any other pharmacists on staff. I do have pharmacy students that are on rotation with me. So we're really bringing that clinical expertise to the organization. And so, sometimes I'll be doing, a lot of emails and, having to maintain that professional persona and, thinking about strategic things like that, planning presentations. I'll be going over to South Carolina to talk with the South Carolina SHP or ASHP division, talking about healthcare is getting disrupted. Is pharmacy ready? So excited to be, traveling and giving some presentations about current pharmacy trends, which is, a lot of what I do with my podcast, Talk to Your Pharmacist. So it definitely varies, but I usually have a pretty full plate, which keeps me busy and enjoy having students to share that kind of mixture of a little bit of managed care, management, public health, and mission.
That is just really interesting just because obviously it's not the most traditional type of pharmacy position, but what I find very fascinating is just the role that you're playing and how far the reach is. You mentioned 31 states, multiple facilities that you're helping facilitate the distribution. I mean, I just think that's amazing.
It is. And, being able to visit, the pharmacists and, pharmacy technicians that are actually doing the work and taking care of patients is probably my favorite part of my role, is when I get the opportunity to go out in the field and, learn from them too, because then I'm able to bring it back and put together resources and share those best practices across our network of pharmacies and clinics.
That's really cool. Well, Hillary, in our profession, there is a lot of negativity with pharmacist job satisfaction, just the role in general. What do you like about being a pharmacist and about your job in general?
That's a great question. And, I'll tell you what, when I was, planning to go to college, I thought I was going into med school. My parents actually encouraged me to apply to Ole Miss's early entry pharmacy program. And, all along, I, kind of thought that I was still going to go to med school, but it wasn't really until my fourth year of pharmacy, getting to do all of the awesome rotations, and see the great diversity that pharmacists have, opportunities for. And I mean, it's just blown up even since I was in school. But that was really the exciting, where my passion just really kind of took off, about all of the different opportunities, pharmacists being in the pharmaceutical industry, or, playing really integral roles all throughout the hospital setting. And then, now we're really seeing pharmacists heavily embedded in physician practices and, finally being recognized with some provider status designations in certain states. So I think we're going to start to see that happen in different states. As we're moving from fee for service to value-based care, it's going to be so important for pharmacists to demonstrate the value that we bring to the healthcare team. So I think that's something that we all need to keep in mind.
Yeah, I definitely agree. So you're doing amazing things at the Dispensary of Hope and reaching a lot of people. But at what point did you say, you know what, I have this entrepreneurial itch and I really want to start a business or just do something in addition to my full-time job?
Yeah. I have always been a or I guess just very disciplined about time management. Growing up, I played, just about every sport. Being from a small town was great in that I had a lot of opportunities. So I've always been really regimented with my schedule. And so staying busy is something that I enjoy. And so after pharmacy school and then residency and then, being in Nashville, after I've been in Nashville for about a year or two, and then, met my husband who's very entrepreneurial. Nashville is just such a great place for entrepreneurism and innovation in healthcare. And, starting this podcast was something that, I'd been listening to podcasts about entrepreneurship. I loved Entrepreneur on Fire, How I Built This, TED Talks. There's, Masters of Scale is one by Reid Hoffman, the founder of LinkedIn. I'd been listening to all of these and thought, wow, I'd love to be able to consume content about pharmacy and all of the different trends and things going on there. so much is happening and it's hard to keep up with everything. And so, that's really in the spring of 2017 was kind of when I had this vision, and I'm such a doer. Once I get something in my head, I'm like, okay, I've got to do it. And so, it was created really for pharmacists and student pharmacists and others who want to hear from industry leaders about their leadership stories and perspectives on healthcare topics. And it's just been kind of a fun passion that has turned into, a revenue source. So it's always great whenever you can fund your passions. So it's been a really fun journey.
Definitely. So what are the ways you're monetizing it right now?
Yeah. So, I really had no expectations on the podcast. I thought, I'm just going to start doing it and see where it goes. Of course, some goals would have been like, oh, I'd love to get a sponsor or, do affiliate marketing or, maybe doing a podcast will lead me to get some paid speaking or consulting engagements, which is really why I put it all under the umbrella of the Pharmacy Advisory Group. So I could have, do advising for companies and things like that. But, actually, the way that I've been monetizing it is, some of these companies have just organically come to me. So, I just stuck with it I think I produced, about over 40 episodes in the first year. So I was almost releasing one a week, which I have been doing that now because I have a sponsorship commitment. But, after doing it almost a year, I was approached by TheraWorks Relief, which is an over-the-counter muscle cramp reliever. And have been working with them for since August of 2018. And I don't support any, or I'm not going to sponsor any products that I don't fully support and believe in. And so after, learning about the company, getting a sample of it, I went through all of that. And, I can honestly say that I use it and I've got family members who use it. So, for me, I don't necessarily get a lot of like cramps, as typically you might when you get older, have some electrolyte things, restless leg, things like that. But from like workouts and things, I guess I tend to use it for that. But I've got family members using it. And then secondly, another company, RX Destroyer, is the newest sponsor that we are partnering with. And it's a really neat company as well. And they're a chemical drug destruction solution. So basically, it inactivates medications using activated charcoal. They've got, a unique mechanism there, but it's a drug disposal solution for individuals. We've got kind of the opioid crisis right now. And, people don't want to have all of these unwanted meds at home. So they can get that product at Walgreens or for businesses. So, long-term care facilities, other facilities who have to be responsible for destruction of medications, they can use this RX Destroyer, and it, helps protect our water supply. They're compliant. So it's been really fun that those two companies have been able to essentially seek me out and have really enjoyed being able to work with them and, share about their great products with the pharmacy community. So.
Yeah, and I think that's really cool. Like when you fully believe in products or services, it's pretty easy to promote those. And that's similar to what we do on this podcast as well. But making sure that you vet those companies and services that you're going to trust them yourselves or with your family members, promoting them or encouraging them to use those. So I think that's one thing that's really key, because unfortunately there can be a dark side. I know a number of podcasts or just websites, and they'll basically promote anything, just based on the traffic that they get. So I think that's a really cool process in the way that you took that approach.
Yeah, I definitely don't want to promote anything that I don't fully believe in.
So talk about some of the struggles, the challenges, just getting a podcast up and running, because now I can't take credit, because the other Tims were the ones that really got this one going from the ground floor. But obviously there's a lot involved. So talk a little bit about the beginning stages. What was tough for you? What were some of the challenges?
Oh, there's a lot of tough things, because, it's just like anything when you haven't done it before. You're like, well, how do I take the next step? So I was really lucky in getting to connect with two other guys here in Nashville who were really generous about sharing their stories. Matt Bodnar has a really successful podcast called The Science of Success, and he's basically outsourced his entire production, which is certainly something that I would love to do. He can basically come in, read the guest bio, and everything's pretty much done. He's just the personality and can kind of handle all of that. Now, someone else was, sharing a little bit about, Zencastr. Like, that's Tim, you and I, we both are using that as our program to be able to do the recordings. But there are plenty of other recordings, and so this friend, David Schifrin, who works with Health Further, which is a health, I guess they were solely doing conferences, but they're doing a little bit of a transition, but all about the future of health and bringing different stakeholders together. He shared how he was doing their podcast, and, actually showed me Zencast, seeing him, very visual, getting to see how it worked, how you do the recording. It's saved in Dropbox. You've got to find a host for that. A host site to host your podcast. And so, right now I'm still doing like start to finish, everything from identifying the guests, which for me, that's the easiest part. Is I feel like I've got a great network of people. I've been really fortunate to, I'm pretty extroverted, I guess you could say, for a pharmacist, and enjoy meeting people and staying up to date on news. So that's the fun part, is getting to talk to and identify guests. But, you've got to do the scheduling and then
And the editing.
and the recording. I use GarageBand for my editing, and so none of these things were things that I knew beforehand. Like, luckily for me, I thought, yeah, my husband's really techie, I'll just get him to do it. And he said, no, this is your project. You need to learn. So there is a true value in YouTube videos. So, a lot of YouTube videos, learning how to do some of the editing. You just have to stick with it. And the first episode that you do, or the first thing that you do, and you're, maybe you're going to do video, maybe you're going to, whatever you do, it's not going to be perfect. And I know, a lot of times pharmacists are perfectionists, but you just have to get version 1 out there. So once you get version 1 out there, then you can, kind of start refining, and you get in the groove. And once you've done one, so, the whole like, see one, do one, teach one. Once you've done it, then you are kind of on your way.
Wow. It's impressive that you're doing it all, and we've had some help recently after I think episode 50, just because it is very time consuming. That's what I was going to ask you is what's a typical amount of time for you to take an episode from completely fresh start all the way to finished product?
Well, I would say in total, the time to connect with the guest, prep, get my questions, do the interview, do the editing. I do have a template that I have for editing, so that helps. And then uploading it and, revising on SoundCloud, I would say is probably about 2 hours. I've kind of got it nailed down now.
Yeah, it sounds like it. Because I remember, I think one episode I had to edit, and it took me, I think, at least 2 hours to just do the editing. Yeah. Because the tracks were off between the guest and the host or something like that. And I thought to myself, like, this is terrible because I didn't know the best ways how to be efficient on that. But I think, like you said, you can definitely cut down the time on a lot of the tasks, but even just getting it up to iTunes, up to that point, the tasks of actually putting it live, there's a lot of things involved. And then there's a whole other animal of actually promoting it. One of the things that you do is really cool is I don't know if you're using the same tool that we are. We use Wave, I think it's Waveform or Wave or something like that. But how you're showing like the different clips or the audio clips with guests, it's a really cool way that you're putting out your podcasts when you release those.
Yes, and that's new, and that's something that I learned from someone else. So another pharmacist, Megan Nicole, who's with the Lazy Millennial, I saw her do it and interviewed her as a guest, and I'm like, Megan, how do you do that? And so, as long as we're sharing information and, just helping others out. So I think that's really important.
Well, I think you've done a great job, and I've listened to a number of the episodes, and it's really cool the variety of guests that you bring on and topics that you discuss. And obviously it's doing well and it's successful because I think you're up to what, episode 74, 75 right now?
Yes.
Yeah. That's incredible. I mean, I've heard stats that so many podcasts, they stop producing after just a small number of episodes. So I think that's cool that you've kept it up and persevered, because I know that there's some weeks, depending on how involved you are, where it can be tough to manage everything else you have going on and make it be successful.
Totally. But, batching some of the work, as we were talking about earlier, is helpful. And, sometimes at a point you do have to do some outsourcing. Like, getting an intern to help, or, a student pharmacist helping me grow my, Instagram business. That was definitely with a little bit of help from, one of the pharmacy students here in Nashville. She's been awesome. Christy Fritz, she's over at Belmont. And I think she's now doing APHA's student Instagram account. So she's one of the people behind that now. So she's been awesome. So yeah, you've just got to be able to kind of, know what you can do and what, when you need to bring in other people, and, make it most effective in that way.
So besides the podcast, I know you're doing a couple other things for side income. Can you talk a little bit about those?
I've also done a couple of things. I have a passion for students and, love doing precepting, but realized that, residencies are becoming so competitive. So I hosted 2 webinars before, the residency interview process really got started, and, charged a little bit for that, but, a reasonable amount for a student. But then put all of that content together into an on-demand online course and that's available at residencybootcamp.teachable.com. And so that'll be available, next year and the next year. So it's, really evergreen content, and at an affordable price. So next year when students are ready to look at interviews and things, but it's really applicable for any interview process too. So, a lot of those things are transferable. The final thing that I do, and it's helpful to stay in touch with, what's happening in the retail setting, is I'll still do some moonlighting for a retail pharmacy chain. And it helps to keep me, up to date on what's happening in that space. But it's always helpful to have a little extra fun money for, shopping or different things.
Is that where most of the additional income is coming? Is that where it's going?
Well, we actually are really fortunate because we do a lot of saving. So we live off of my income solely. So, a lot of times people are living on two incomes, and then you add, another person, and then you take away an income, and then you're like, whoa, we're used to this extravagant lifestyle. So, we've been really diligent about trying to live off of, one income since we've been married. But we still love to travel. I mean, we've taken amazing trips to Greece, Cuba. We went to Thailand for our honeymoon. We're always, doing some kind of adventure trip, whether it's even to, family vacations to Whistler or Breckenridge. But we enjoy to travel, and, doing fun things around Nashville. But we also have a good balance. So having that budget of getting used to living on one income has been really helpful as we're, getting ready for the next phase of life and, planning for family and all of that kind of thing.
So how do you manage all of these things that you're doing with your full-time job and personal life? Because I hear from a lot of pharmacists who say, I'm just trying to make it at my full-time job and, keep sanity at home with their significant other or their family. What seems to work best for you?
Well, I really enjoy my job. And so I don't have a lot of stress from that. But when I am home, I really try to make sure that part of my life is healthy too. So, getting 8 hours of sleep, drinking, you're supposed to drink your body weight divided by 2, like that many ounces. So like drinking enough water, exercising, a big fitness person and, love to do triathlons and things in the summer. We don't watch a lot of TV. So it's, I don't come home and turn on the TV. Oftentimes I'm not even turning that on. I'm, working on, make dinner, make sure I've had a workout in and have some, quality time with my husband. And, maybe I'm preparing for Bible study or something, but sometimes it just depends. It's, you have different seasons of life. And sometimes I do feel really busy. Like last year, there were definitely 2018 was a pretty big year for our family. But, I think that you've got to be able to prioritize and make sure you're taking care of yourself. So
I definitely agree. And I think you hit it there where there's seasons where you're going to be really shifted in one direction. And I kind of believe in that mentality. There was a book called The One Thing by Gary Keller and Jay Papasan, and they kind of demystify and debunk the myth of work-life balance, in that if you try to be balanced in everything, that what ends up happening is you basically just become mediocre at all of those things. And sometimes to really achieve the next level of success, that you're going to be shifted in that direction, temporarily. And then obviously you have to come back in order to maintain relationships and other aspects of your life. But it sounds like that's sort of the way that the rhythm for the way things have gone for you.
I would say so. Yeah.
So what advice, Hillary, would you give to other pharmacists and even students out there who have an interest in becoming an entrepreneur?
I would say stick with it. So you're, maybe not going to find the ultimate success within the first week or 6 months or a year. It's going to take a while. So, stick with it and, keep working hard, put in that work ethic, stay hungry. I think that's term is kind of often used at the Entrepreneur Center in Nashville. It's, you want to stay hungry and keep looking for things. I think, if you follow some of the great entrepreneurs who are out there doing some awesome things like Tony Robbins and Gary Vaynerchuk and, some of the other ones who you've got to, follow people that you want to be like. So if there are pharmacy leaders that, maybe you want to own your own business, well, look at who in pharmacy is doing that. You guys have interviewed a lot of entrepreneurs, start following some of those guests. What did they do? But, ultimately, I think that as long as you're providing value, that's key. I think, something that I've really focused on a lot over the past 2 years is not only personal and professional development and, reading books. So that lifelong learning is just so important.
Yeah, I was going to ask you which ones would you recommend that have had a big impact on your life?
Well, I think one of the biggest ones was 7 Habits of Highly Effective People. And the sad thing is that I got this book as a resident and felt like I didn't have time to read it. And then, now in my current role at Dispensary of Hope, we read it, or I read that. And then as an organization, we read it. And that was just kind of, had so many aha moments. But I now use Audible, which helps to, consume more of that content, kind of like what I enjoy with the podcast, being able to listen to it when you're in the car, traveling, being efficient. Maybe you're at a workout, trying to get your workout in and read a book. Some of the other great ones that I've read about, kind of business or entrepreneurship have been Good to Great, Entree Leadership by Dave Ramsey, Outliers, The Story of Success by Malcolm Gladwell. And then right now I just finished Crush It by Gary Vaynerchuk. And so, there's probably so many more. Actually, Tim Ulbrich recommended reading when I connected with him. The one on Never Split the Difference. So that's kind of been
about negotiation.
Yes, yeah. And these are just some of these are like life skills. And so, how do you handle conflict resolution and, even like learning more about change management. I think John Cotter is the one that has a couple books out on that. You've got to be able to lead. And so any type of books on leadership, and I think those are all, going to be really helpful.
Well, Hillary, it's been a pleasure having you on the show, and really appreciate you sharing your story and all the things that you're up to. What is the best way for someone to reach out or learn more about what you do?
Absolutely. I love getting to connect with other people. So first, the website is www.pharmacyadvisory.com. And there are show notes for any of the podcast episodes there and a sign up for our email list. So when we do newsletters and things, you can find us there. Have a Facebook page and Instagram account as Talk to Your Pharmacist. And you can find me on Twitter and LinkedIn as Hillary Blackburn.
Great. Thank you so much, Hillary.
Awesome. Thanks, Tim. It was so fun to get to talk with you. Thanks for having me as a guest.